All right, we're gonna get started. You guys, are we good online?
Yeah.
Okay. We've got quite a few people online, it looks like, so that's great. Okay, good. All right, good to see you all again this week. We have a treat this week because of the Transit Symposium yesterday. We had two special guests who are very good friends of mine, in addition to being colleagues, who we're doing some joint research with. And so they came out to work on that research and to give talks at the Transit Symposium. So I threw ITS for a curve, and you guys have two speakers this week, which just about blew everyone's minds, because apparently this is never is nothing if not a rule breaker. So
we're both named Greg.
yeah, to make it slightly easier, they're both named Greg, or maybe Hunter. So the way we're gonna do this is these guys know that they're sharing the time slot. We may go over a bit past 3 o'clock, apologies in advance, but we're trying to get 2 people in and have you guys actually learn something about both of their research while they're here in town. So we're gonna start with Greg Macfarlane, and we're gonna do the whole spiel kind of, half of the time, and then we're gonna switch to Greg Erhardt and do the same thing over again. So let me introduce Dr. Greg Macfarlane. He did his PhD at Georgia Tech at the same time that I was a baby professor there. And so we've known each other for a long time. I actually had the distinct pleasure of being the person who hooded Greg when he graduated with his PhD. He has since gone on to have a fantastic career in demand modeling for a number of different consulting firms, including a startup. Previous speaker that we had 2 years ago, Josie Kressner, he worked in partnership with Josie on a lot of her work. So for those of you who were around when Josie spoke, you know a bit about that. And for those of you who won't, and you're interested in how to make so much money selling your startup that you no longer work for a living at 40 years old, then you should go back and look at her talk.
You should talk to Josie.
Greg is now a professor at Brigham University in Provo, Utah, where he continues to do the same sort of work. And I will turn it over to him to talk about the potential for transit to improve access to quality nutrition.
Yeah, so this was a slide. This was a title that I gave to get people in the room, I guess. The short answer is it's really hard, and the potential to do this is low, but we'll take a while to get there. So we're gonna start with this question of accessibility. You guys probably get this hammered into you for reasons you'll see in a minute. Application, and we'll talk about application 1 and 2, and the next steps is very short. So the timeline on this outline slide is not representative of the time spent on each thing. All right, so in 1997, Susan Handy and Deb Niemeyer wrote a really important, to me at least, paper about accessibility. What it is, how to measure it, and the sort of idea behind this is that you can just, know what accessibility is, right? You feel when you're in a place that you can get to a lot of other stuff from, it's something it's a vibe of an area, right? And because it's so important to how people perceive the society and the infrastructure around them, we want to quantify it. But it's much easier to describe what accessibility is than to quantify it. And so we've got lots of different ways of quantifying it. And so let's look at number 1. It's just, well, how close are you to the nearest X? Right? We do this in transit modeling all the time. Do you live within a quarter mile of a transit stop? Do you live within half a mile of a park or a library, and whatever the thing in your sort of frame of reference is, right? This is really easy. It's something you can do in your first week of learning ArcMap, right? Like you can do this kind of analysis pretty easily. A key issue is that you need to pick a mode, right? You've got to decide 10 minutes by bike, by walk, by drive. And so that definition of how you describe this ends up affecting your measurement. And if you just pick driving, then you're being exclusionary. If you just pick walking, then you're not acknowledging the fact that like 90% of people drive, right? So you've got this dual problem there. It also ignores a lot of stuff people care about, right? It treats every transit station the same. Whether is it fixed route transit, is it flex transit, is it high capacity transit? Like you've got to come up with all these definitions, and those definitions also change your measurement. A slightly more advanced method is this cumulative opportunities measure, where it's not just how do I measure the nearest distance to X. It's I'm going to draw a line around me and count how many of X there are inside that line, right? You get the same drawbacks though. You've got to pick a mode and you've got to decide what counts as something, right? If you're doing access to grocery stores and you're like, well, how many grocery stores can I get to in a 20-minute drive? The question is, well, what counts as a grocery store? Does it have to have a produce section? Even though a lot of people buy their food from convenience stores or dollar stores that don't have produce section. So do you want to ignore those, or do you want to count them but then recognize that you're counting something that isn't the same thing as the other thing, right? So you've got these two problems that you've got to deal with. And the end result of this is some number like you can reach 32,000 jobs within 30 minutes by driving. And that's an interesting measure. You can look at this and say, okay, all right, we're going to improve the highway system. That gets us to 33,000 jobs in 30 minutes. Is that something people care about? Is that something they notice? It's harder to make the argument that they do. You can get really complex with this, especially with transit. Once you start doing this for transit systems, the question is like, well, if I leave right now to get to somewhere, it'll take me 35 minutes on transit. But if I wait 4 minutes, it'll take me 27 minutes. Like, because of the different transfers and stuff. So this company called Conveil has done, I think, a really good job. You can load a GTFS network in, and it gives you like, you can pick, well, here's my 30 minutes on transit at the 95th percentile. So 95% of the trips I start within this hour can get to this destination within 30 minutes. So they spent a lot of time thinking through this transit travel time problem. But at the end of the day, it's still just how many jobs are there or how many opportunities of X, and they count them all equally. A way to get around that a little bit is with like a gravity model. So the idea here is you're going to measure how far it is to all the places you care about, and then multiply it by some function that discounts longer trips more, right? So you may live within a reasonable distance of 10 parks, but the park that's far away from you doesn't mean as much as the park that's closer. So you're going to kind of, it's like a cumulative opportunities measure, but now we're weighting it by the distance. So and that also allows you to say, well, is a 29-minute trip really different from a 31-minute trip? It's not. Like, people behave exactly the same way on these two trip lengths, but we draw this hard line of 30 minutes. Or why is it not 40? Why is it not 45? You have to have these fights with these kinds of measures. Gravity gets around that, but you still have this challenge of, well, X minutes by what mode? And you still haven't solved the problem of what are you counting as an opportunity? What gets added to this set and what doesn't? So the way to kind of resolve a lot of these difficulties is using a destination choice utility model. So what you do is you give people a set of options and look at which one they picked. You go look at the attributes of the option that they picked, including, does it have a produce section? What's the price of chicken? What kinds of transit services are available at that destination? Whatever the destination is, you can give attributes of it. Look at how those attributes influence people's choices, and then use this log sum where you take the utility that you measure, exponentiate it, add it up for all the options, and then take the log of that. The challenge then with this is, instead of like 32,000 jobs within 30 minutes, which is maybe a meaningless number, but it's a number that people can understand, you get something that looks like the log sum value is minus 20.13. It's like, what does that mean? That's a little harder. And in order to get to this number, you have to go through Kenneth Train's discrete events with simulation, right? Like the discrete choice with simulation textbook. So there's no real way to win in this scenario. You can either have an overly simplistic measure or maybe an overly complex measure. The simplistic measure doesn't really measure anything that maybe potentially. The complex measure is really hard to explain to your boss or your neighbor when he comes to the public meeting. Right? So that's kind of the tension here. But I think it matters because a lot of the research we've done, both in transportation, but also like in city planning and public health, for instance, is using these fairly simplistic measures of, do you live within half a mile of a park? So I wrote a paper a couple years ago with Carrie and a couple other people. Nico Boyd is an MS student at Georgia Tech, and John Taylor is a faculty member there. About parks and health. So the idea is we love parks. Parks are wonderful. We feel better when we're inside a park. We feel better after we've gone to a park. When we're at a park, we are often exercising, or walking, or playing sports, or something like that. So parks, we think, probably make people healthier. And we think maybe people who live near parks might be healthier than people who don't live near parks. The challenge is there's been a ton of research on this, like dozens and dozens of papers over the last couple of decades. And they all find like very different things. And one of the reasons why they find such different things is because they use totally different measures of accessibility. Like one person will say, do you live within a 10-minute walk of a park? Another person will say, how much green space is in your census tract or within a mile of your house? Or like you have all these different definitions you're working with, all of which are valid in some definition, but which lead to different interpretations of these health elements. So we solved this problem by adding yet another accessibility measure to the problem. So we got this data from the BRFIS. That is what they call it. According to my colleagues in public health. So there's this behavioral risk factor surveillance system where CDC goes around and gets vital statistics in an anonymized form from like patient hospital records. This is then aggregated, and there's a model that they build that gives these results for every census tract in 500 of the largest cities in the US. So this is New York, and what we've got here is on the x-axis you have the percent of adults to their doctor. And then here you have the percentage of adults who are obese in that census tract. And you see there's a strong negative relationship, as you would expect, right? People who live, census tracts where people exercise more also tend to have fewer people who are obese. Okay. So this is what this data is. We get this for every census tract in New York, and then we want to say, okay, well, which of these tracts have better access to parks than others? Is there an additional relationship? Do people who live near parks engage in more physical activity and thereby have better, obesity rates? But this brings up the question of what is a park, and what do people do in parks, right? Both of these, I think you would easily describe as a park, but they're very different, like, facilities. And maybe you are into one of them, or maybe you're into the other one, or maybe you're into both, but at different times and for different activities and for different reasons, right? The number of things that might attract people to parks, playgrounds, tennis courts, just general open spaces, sport fields, like you could draw a very long list of things that attract people to parks. And if you really want this kind of park, but live right next to this kind of park doesn't help you exercise or do the things that you might do. It might be beneficial to you, but this is where you do your exercise because you're on a soccer team, right? So this is the idea here. There's also you could live across the street from, this square out here might be called a park, right? And so if you lived in one of these apartments, you might have very good access to this park. But maybe there's a 30-acre park, on the north side of town that you live further away from, but because it's so big, you go there and you meet people there. So there's this trade-off. Not all parks are equal. They want to try to have every American living, as many Americans as possible, living within a 10-minute walk of a park. In New York City, that's effectively every street in the city, because what they call a park includes like tiny little community squares like this, right? Obviously, Central Park and Prospect Park in Brooklyn are massive pieces of recreational real estate. Not everyone lives within 10 minutes of Central Park. A person who lives within 10 minutes of Central Park has much better park access than a person who lives within 10 minutes of a very pleasant community green like this one. So what we did was we estimated, or we actually picked a destination choice model that someone else had published, put it into New York City with walk travel times, and built a much more sort of robust map of which neighborhoods have good or poor park access than this one over here. And then we estimated a model of, so these are the coefficients from models that predict physical activity, right? So if you live in a census tract with more young adults, then you're going to see more physical activity. You're on this side of the line. You also are going to see less obesity because you're on this side of the line. And the obesity model controls for physical activity. So this model informs this one. And yeah, this 10-minute walk access term ends up not being very useful in predicting health outcomes. But different formulations of a log sum based model got much better, or we were able to get a much more significant read on what may be happening. Is this causal? Probably not. But the answer is the answer to the overall question is the method of measuring accessibility matters a lot. You will get different answers using different tools, which is not that surprising, but it's important for public health researchers who often, they don't know what transport destination choice log sums are. They do have a student who learned how to use ArcMap, and so they use these 10-minute walk buffers or half-mile walk buffers or things like that. And maybe that's clouding our understanding of land use. Okay, so switching to the next project. This is work that is currently under review. I hope it will get out this summer. We'll see. Emma Stuckey was my master's student. She did this for her thesis a couple years ago. Alicia Reynolds and Lori Spruance are in BYU's public health department, and so they are experts in early childhood nutrition and the grocery market, and so we teamed up to do this study together. Talk about food deserts. This is Monument Valley in Utah. It is a literal desert. It is also a food desert. So this right here is the Four Corners set, because there are 4 states who have their corners right here. And this whole area is sort of the Navajo Nation Indian Reservation. There are a lot of people who live in this area. Tens of thousands of people live kind of scattered around this area. Their incomes are low. Their mobility is low. And so there's a challenge in getting them adequate nutrition. People who live in this area, including in sort of the non-reservation towns of like Blanding, Utah or whatever, like there's a little tiny there's a Dollar General in Blanding. That's the food you can buy in Blanding. There's Dollar General, there's like a gas station. So what people do on the reservation or in these other small towns is a couple times a month, they drive 4 hours to Farmington, New Mexico, where there's a Costco and a Walmart, and they load up, and then they drive back, right? So instead of groceries being a couple times a week thing, like it often is in urban areas, daily if you're from Europe, it's like a couple times a month we will go and go to the Costco and the Walmart. And so then when we need fresh produce it's hard to buy it a month or in advance, right? So they don't really have a lot of fresh produce in their diet. When they need like a gallon of milk or a loaf of bread or something, they're buying it at a gas station or Dollar General. But there's this question of which grocery store do you go to? It's very much like the park. Do you go to the closest one? Probably not. Maybe you have a membership to a discount club that's on the outside of town, or maybe you really value the butcher at a different place that's more expensive, right? So there's this whole relationship between the quality of food on offer, the price of the food, the transportation that you use to get to the food. All these kinds of things play into your choice of which grocery store you go to. And so what we did is we developed this methodology where we took the Nutritional Environment Measures Survey, which was developed by some people at Penn to look at food deserts. It's sort of a validated measure. It has some weaknesses, but it's one that's available. And so what we did was we sent our students to every grocery store in a few different communities, and they walked down the aisles and noted how many different kinds of milk are there, how much real estate does that milk take up on the shelf, what's the price of broccoli, what's the price of chicken breasts, what's the price of all this other stuff. We also got origin destination data, so we worked with Streetlight, drew a boundary around all these grocery stores, and then got where the mobile devices who went to that store, where they came from, or rather where their residence is. So we see here's a store, it has this price of goods and this availability of goods, and its catchment area is this. And then the last piece is we used OpenStreetMap plus GTFS with the R5R routing engine to get a multimodal picture of accessibility, the modal accessibility, modal impedances from every store to every census block in the region. We put these together, we build a sort of simulated aggregate model population where we simulate people's destination choices given the Streetlight data. Streetlight data is kind of the pivot that allows us to get these models out of it. And then based on those models, we can then start to evaluate this accessibility. We can observe where people have good access, where they have poor access. And this access is based not just on the travel time, but also on the price of the good. So if you have really close access to a terrible grocery store, you have worse access than somebody who has kind of good travel access to a very good grocery store. If that makes sense. So both the transportation and the quality of the store are measured here together. And we did, like I said, we did this in 3 communities. So West Valley City is sort of a lower income neighborhood in the Salt Lake metro region. There's a large minority community, mostly Hispanic and Pacific Islander, sort of Samoan, Tongan population in this neighborhood. It's more of what you think of when you see the term food desert in literature, right? Utah County is where I live. It's a wealthier area, sort of more suburban, with pockets of sort of small town urbanization like Davis in Provo. And then San Juan County, which, as we talked about, is extremely rural. So the lowest population densities in North America kind of place, right? And of course, there's a large minority population there too, with the large this graphic did not come through very well, did it? I guess when we compressed the image, we dropped the points. The line is there. We can work with that. So this availability score is this: how good is the quality of food available at the store? And then this market basket cost is how much would it cost to fill the USDA average market basket at that grocery store. So this is like what a family of 4 consumes in a month based on USDA numbers. And this is like how good of a grocery store it is based on food that's available. And there is actually a better score is 0. So it's a weird measure. But you can see that as the score gets better, the market basket gets more expensive, right? Because more expensive stores on average today. But we also have this challenge where, like, Utah County, which is the wealthiest area, has a lower sort of average price than either the low-income minority neighborhood in Salt Lake City or the rural area, right? So these are the poorest people, but they are paying the most for groceries because it's hard to offer the services there. They're buying a lot of stuff at dollar stores and things like that. So then we estimate our destination choice model, and we do this individually for each of these counties. And you can see small variations in the counties, but here's our zero line, right? So as the market basket gets more expensive, people are less willing to go there, right? Because it's a negative coefficient. Whereas registers, size of the grocery store, as the grocery store gets bigger, more people go there. Right? So it's correlated with more people going there. And so this mode choice log sum, this is sort of the average transport costs among all the different modes. You can see this is actually a fairly big effect, and it's very different in each of these areas. The people in San Juan County are the least sensitive to travel distances, which makes sense because they're the ones driving 4 hours to get to Costco in New Mexico. But with this model, now we have a model that is sensitive to sort of the price of goods at the grocery store, the availability of different goods at the grocery store, and multimodal transport costs. And so we can have this model and we can test things with it. So the first one we did, so we said, well, what if we just went in and put a new store in the middle of this sort of traditional food desert? And what the color here is this is the benefit in dollars, which you can do with some fancy choice modeling math. And so these people right around the store get about a $3 benefit by having a store a little bit closer to them than they would have had otherwise. Right? So you add up this benefit across all the people, and you can get an aggregate benefit, which you can compare to the cost of installing the store and see if this is a positive or negative benefit to them. Intervention 2 was, well, okay, instead of adding a brand new store that's kind of like the average of the full service grocery store, what if we take a dollar store and just make it better? So there are a lot of grants that people have given, like, here's some money, a couple $100,000, go install refrigeration units so you can offer fresh produce in your dollar store. And so then this shows the people who benefit from that, and the benefits are kind of on the same scale, right? But they're very limited. You're mostly helping the people in the immediate area around there. Intervention 3 says, well, what if we make the transportation system better? So what we did was we capped transit access, wait, and transfer times. So like the most you're going to wait for a bus is 5 minutes. If you had a lower weight than that, you kept your lower weight, but we capped everything in our transport matrix. We also made active transport. It's just instead of the distance along whatever bike trail OpenStreetMap had, it's now a straight line distance. So it's like totally unimpeded. And you can see the benefits are distributed over a much wider area, but the benefits themselves are much smaller, right? They're an order of magnitude smaller than the benefits you get by improving stores. Intervention 4, this is, well, what if we have deliveries? So we picked four of the full service grocery stores in the area. We said, okay, for everyone who lives within 3 kilometers of this store, your transport costs are now 0, but the cost of your goods goes up by $10, right? So you're paying a delivery fee, but no transport costs. Whether that's a reasonable assumption, we're fighting with our reviewers about. And you can see the benefits again are widely distributed, and they're huge, right? They're an order of magnitude higher than even the best of the options before. So we can aggregate these benefits up, kind of allocate them to different population groups based on who is living in each of these census tracts. And so the way to read this, so a new store brings about $12 million, $13 million in benefits to the people in that area, and 6 million of those, so all these are for Salt Lake City, except for this one we did in a few different places. about half of those benefits are going to non-white households. Right? So we can sort of evaluate some equity issues with this analysis too. A new store in Salt Lake City brings $13 million in benefits. An improved store brings about half that. It costs less than half to improve a store than it does to build a new store, right? So this is probably a more efficient policy than incentivizing new stores to go in. Improving transport was not really efficient. 5-minute wait times, 5-minute transfer times, direct line active transport, like the cost of this investment is enormous for very little added benefit. Now, one thing here is that this the benefits would accrue to all kinds of destinations, right? We're only looking at grocery stores here. So you may have to think of other destinations, but for right now, improving the transport system doesn't seem to be our best option. And then delivery services, I don't know that I believe that number. It's possible that there's some weird stuff happening as you get close to zero transport costs that I need to think through a little bit. This is another thing we're fighting with our reviewers about. But yeah, the benefits of delivery services are enormous compared to the benefits of just improving the land use. And so, like, in transportation engineering, in general, like, we came into this field to make it easier for people to go from place to place. And then we learn about land use and how important it is to like build land uses that people want to go to. But it may be that the answer to some of these big problems isn't either of those. It may be that like more efficient delivery services are the way to improve people's livelihoods. Potentially, I don't know. We'll see what happens. And then, you know, we could do a lot to disaggregate this. Like we could apply a synthetic population to it. We could look at their activity-based travel patterns and get a better read on who's going to the grocery store when. We haven't done that, but that could be next steps. Anyways, that's what I got.
Thank you.
Thanks.
I know. Is there a hand?
Right behind you.
See, go for it.
So that caveat that you just brought up of that improving, there would be positive externalities from improving the transportation network beyond grocery access.
That's right.
And then I would think that there would also be negative externalities that come with improving delivery.
There could be.
Because you have more movement on roads, which would congest access to other places.
I mean, think about it. If you replace every trip that somebody is making to a grocery store with a single delivery trip, then you haven't made the system any more or less efficient, right?
Except maybe that the frequency goes up.
Maybe the frequency go up, and part of the problem that we're trying to solve is the people who can't get to the grocery store, right?
Sure.
So there's that option. On the other hand, like if everyone is getting grocery delivery, there's much more opportunity for efficient routing and efficient packing and stuff. So there are other people whose research is more along that line who some of the studies say the travel increased a lot. Some of them say it can be more efficient. That's not really something I've looked at, but it's a real question. Yeah.
Other questions? Go for it.
I just related to that, did you get a little bit deeper into if they were ordering like on like a regular schedule or like every time they wanted something or
Yes.
like it was for pickup, sorry, not like more like a specific place that you can get it or directly to the house?
Yeah, so I didn't look at any of that. Like what my model has is this person on average went to this store because they valued its prices and the distance that they could travel to get there. And so in my model, I can make the store closer to them through delivery, and I can change its prices by making it more and less expensive. The second point on this slide gets more into that question, right? If I had an entire weekly pattern for these people, then I could just look at how often they went to the grocery store. I could also then look at the transit travel time when they're going to the grocery store. For this study, I just picked 9 a.m. on a weekday because that's when the transit accessibility is highest. Even though very few people are going to the grocery store at 9 a.m. on Tuesday, right? So if anything, I'm overstating the availability of transit to some of these destinations and my methods.
Yeah, so another thought I have is, did you look at these locations in relation to schools or work as you have a trip chain?
Yeah, that's the other thing
Or
that's,
school,
right, that's this other thing that's using a disaggregated activity-based approach
Right.
could let me do.
Right.
All I have is the household, right?
Okay.
And honestly, that's what 98% of accessibility research is based on. Even though people spend more of their working hours, if they are workers or students, they spend more of their sort of awake hours at a different location.
Right.
And that's a limitation with all of this research. At least I do have a path where I could look at that, whereas a lot of the research out there can't even get to that.
Right, because I imagine if you had in a high school area, a grocery store right next door.
Right, exactly,
You
yeah.
have 2 trips in one, and then that is almost like you're canceling out even a delivery need because you're already doing that necessary
Right.
trip.
Yeah, and so one challenge with using random utility models for accessibility is just establishing a choice set. Right, that ends up being a really hard part of the problem. In this case, I didn't solve the problem by I just had them choose. I knew which one they went to, and then I had them pick random other ones to compare against. Which is efficient, or it's unbiased but highly inefficient in an econometric sense. If I had more about their daily pattern, what I could do is I could build a time-space prism. It's like, here's their home, they're here at this time, they're here at this time. And so then the choice set is anything in this space.
Right, yeah.
Right, and that would give a much better, a much more efficient estimate on some of these models. But it wouldn't necessarily lead to different outcomes.
I'm sort of wondering about something even kind of halfway in between. I'm thinking about like mobile libraries and like
Yes.
all of these kinds
Yeah.
of things. So could you do it where like they're still coming to the store, but it's like the store is only at the high school in this area on Mondays and on Tuesday. Could you model something like that?
Potentially, yeah, if I had more detailed, like, weekly patterns for the people, right?
Yeah,
But this may be an intermediate solution between deliveries and like building new infrastructure. I was talking with Young-Sun, who's a classmate of mine at Georgia Tech also, he's here at ITS. So Intermountain Healthcare, which is the hospital chain in Utah, has a mobile MRI unit, right? So you got a bunch of people who like have tumors that need to be monitored periodically, who like live in rural areas, like they need an MRI every 6 months, but they live nowhere near a hospital. Building a hospital near them is highly inefficient because you can't even hire an MRI technician in that town, much less spend $4 million building an MRI machine. So what they have is a trailer, a semi-truck trailer with an MRI machine inside it. And they're on a rotation where they drive through all these little communities, and these people who need this periodic medical imaging go to a central place every 6 months, right? And that's a much more efficient solution than building a hospital in every town that has an MRI machine. And maybe, can we think through some of the logistics of doing that for groceries? Or are there other sort of services that we should offer that way? Because dragging a mobile grocery store onto the Navajo reservation a few times a month is probably a lot more efficient than building a grocery store on the Navajo Nation, or having all these people drive to Farmington a couple times a month. Yeah.
last one maybe, go, or do I say
There were 2 hands. I like,
Okay, I was wondering how you measure the quality, like more details of how you measure the quality of your grocery store, and if you could apply a similar framework to like measuring the quality of a park for your earlier study.
yeah, and so with the grocery store, what we did is we sent public health undergrad students with an iPad digital survey, and we just digitized this instrument that these Penn professors had developed, which literally they go down an aisle and mark, what is the price of potato chips? How many potato chips varieties do they have? What is the price of broccoli? How many green vegetable varieties do they have? How many feet of grocery store space do they dedicate to these different food goods? And the purpose of that data really is like getting this like food desert nutrition kinds of stuff. But it wasn't ideal for our study, but it worked, and it's an instrument that we could just pick up off the street. That makes sense. And then for parks, like you can do the same, like we did a study in San Francisco actually a couple years ago where we just grabbed OSM data on like which parks have playgrounds, how many miles of walking trail do they have, and then observed which places people went to. There was one other, I think I can answer quickly.
Oh, it was just a comment. I was gonna say the rural or the mobile grocery store, you may already know this, is what they do in rural Japan where it's mountainous and there's a lot of elderly people. And it's like a specialized vehicle and they have ways of like folding it down. They have like, I don't know how to explain it, but it's like the counters are strapped to the sides of the vehicle and then they fold it down and they bring it up. And it's sort of like a food truck and it's sort of something else.
Yeah.
But they communicate with all of the people on the internet, so they know ahead what their orders are, and they bring like the fresh produce, the frozen meat, everything like that, and they make the rounds through those villages, and it seems to work for them, so.
And Utah has a mobile food pantry, like a lot of places do. But this is more for like non-perishable, like food bank kinds of stuff. It's not, they haven't really moved into like fresh produce yet, so yeah, no, but knowing that they do that in Japan, very, very interesting.
Yes, and so it's like the person who's running the grocery store has a relationship with all the people, they know what their orders are, they order in advance, sometimes they'll bring in little things like pipes.
That's fascinating.
It's like a farmer's market.
Very
Well, yeah, and
Japanese.
then what we came to this conversation with the student is like, this is like a 14th century European traveling market.
Yeah,
Like,
right.
we're reinventing medieval technology, right? Thank you.
So I'll say thank you. I'm gonna switch over to Sean. I will introduce you at the same time. So Greg Erhardt is another Greg who I do a lot of joint research with and have known for a long time. He is an associate professor and I think an endowed one. What is the fancy name for your
It's
position?
an endowed one, yes.
Okay. It has a fancy name. In civil engineering at the University of Kentucky. He did his PhD at the Center for Advanced Spatial Analysis at the University College London, which was a unique program integrating engineering, geography, computer science, and complexity theory. And for anyone who gets to know Greg a little bit better, that makes a lot of sense that those many aspects. He, like Greg Macfarlane and myself, had a long career in consulting before he actually became a professor, and he very much draws on that work and continues to do a lot of local work. So if you guys go to work for agencies in the area in San Francisco, Greg is still a presence here, very much so from his days having worked locally for SFCTA. So with that, I'm going to turn it over to Greg to talk about not San Francisco, but the potential to reduce vehicle miles traveled in the Twin Cities region through mode shift.
Okay, thank you, Carrie. This is work with the Metropolitan Council, which is the Metropolitan Planning Organization for the Twin Cities region, Minneapolis, St. Paul, Minnesota. And special credit here to Matt Conway, who's at University of North Carolina, who did a bunch of the sort of software piece of this, did a great job of it. Actually was the one of the conveyance developers. And Ashley Asmus, whose sort of concept this project was. The context here is, as of 2022, Minnesota Department of Transportation wrote a VMT reduction target, their statewide transportation target. They had a target of a 20% VMT reduction by 2050 per capita, which would be, I think, like 14% or 15% by 2040, which was the range of their plan. A couple of years after that, that got codified in a piece of legislation related to greenhouse gas reduction. And it said, basically directed the state to set a VMT reduction target and that you needed to comply with that. And 20% is kind of a nice number. And I think it's derived on the other end from looking at targets or goals for greenhouse gases. Something similar is here in California. Hopefully you're all aware of Senate Bill 375, which directs metropolitan planning organizations, and I believe the language is they must develop a plan to reduce greenhouse gas emissions from passenger transportation by a certain target, and right now that target is 19% per capita relative to 2005 levels by 2035. And so agencies are working on that now and have developed that. It doesn't say you have to actually do it, it says you have to develop a plan to do it, which is an important distinction to make. The goal of this study, and so you get into this stuff, and shifting trips off of cars, out of cars, onto transit, onto walking, onto biking is a viable mechanism to do that in part, or a viable contributor to that. What tends to happen in my background is in forecasting models. In the forecasting models, you do that, and people say, well, our project doesn't look as good as you think because you didn't account for this. And so you get into this debate about how good the models are. And that debate of, well, did you account for this? Did you account for this? Is your model any good? Can be a distraction from the policy debate. What we really want to be spending our time talking about with the policymakers and the planners is which strategies are most effective and how do we get those, not what's in a mode choice coefficient or how you explain a utility theory based destination choice, whatever it is. So we took a totally different approach here, and we said, we're not going to do any modeling, we're just going to look at the data. And we're going to frame the conversation around that just to get a big picture order of magnitude estimate of what we might be able to do, and we're going to do it in a way that we think they'll understand. So we want to estimate the maximum possible mode shift to alternative modes given the existing land use and travel patterns, not worry anything about the future, just see what's the potential now and what can we do with that. And we're going to do this in a way that's based on surveys and that uses sort of open source reproducible tools. So how we do this is we start from a household travel survey. So we have a smartphone-enabled household travel survey in the Twin Cities region, and they collect a stratified sampling of households that's weighted and expanded to be representative of households in the region. And they ask participants, every member of the household, to install an app on their smartphone. They carry that app around, and every so often it records your location. When it detects that you've moved to a new location, it'll send you a push notification. And the push notification asks, what mode did you use to get here? What's your purpose? Maybe a couple other questions. And so what you get is you get this, and they do that for a week. And so you get this recording of where everyone went for a week and what their travel patterns are. And so this is our baseline of where everyone is going for a week for a period. And they've done this in 2019 and 2021 is what we've used. They just released 2023 data as well. So it provides some ability to monitor it through time as well, and they're sort of on a 2-year cycle now. So for each of these trips, what we're doing is we're calculating for every car trip that occurs, what's the best possible walk path that you could take? What's the best possible bike path that you could take? And what's the best possible transit path that you could take? We do this all on the walk and the bike using OpenStreetMaps, all streets sort of network. And on the transit, we do it using the GTFS data for the region based on the exact time that this person left their departure or in some cases arrived. So we know what the other options. And then we calculate which of these alternatives are feasible. Is it even possible to walk? Is it even possible to take transit? And I'll get here and I'll go as we go kind of how we define that. But in general, you do a survey like this, you get some small percentage of people doing something really weird. There's always something working there. So if we're trying to shift people's behavior, we're not necessarily replicating the people who do something really unusual. We want to replicate kind of what most of other people do. So if there's 5% of more or more of people who do something similar in this survey, say, yeah, that's feasible, you might consider that. And I'll walk you through kind of what that means. And that 5% is an arbitrary threshold, but it gives us something to base it on in data rather than just kind of coming up with it. And then for each of those that are feasible, we compute the travel time of each of these four options of car, walk, bike, transit. And we just see how those compare. And as a baseline, we're setting some threshold. You can look at this and how many of those alternative trips are within 5 minutes, within 15 minutes of driving, within 30 minutes of driving. See what that looks like. And the idea is the trips that are going to be most likely to switch are those that are time competitive. And so let's see kind of how many of these other trips are both feasible and time competitive. Okay, so finding the best alternative route, big picture on the, and I'll walk through kind of the details of this as we go, but on the walking routes, we're assuming people have some preference to lower speed streets than walking on a big busy alternative. And so we weight things accordingly as we build these paths. On biking, we consider something called the level of traffic stress, which is a measure of basically how likely you are to get run over by a truck, if you will, how busy it is. And then on the transit, we assume that if I'm going to work, school, or medical appointment, that my arrival time is controlling, and that for other things, my departure time is controlled. So I might need to shift accordingly. On the feasible, I'll walk you through kind of what these look like as we go through each mode, but these are the types of metrics. And we're defining these based on sort of some consideration of hypotheses of what people might consider or might not do, and then looking in the data to see if there are more people that do that or not. Okay, so what I'm going to do here is I'm going to walk through each mode at a time and sort of show how we're doing it, and then what the results look like. So walking, we found a paper from how I think it's Virginia DOT is doing some project scoring as they invest in walking infrastructure. And it just says, okay, I'm going to apply some penalty that on the best streets, I'm going to walk at 3 miles per hour. And on worse streets, maybe I walk a little bit slower. And that's a function of the facility type, how many lanes there are, and what the speed limit is. So if I've got sidewalks on a 4-lane local road, I'm walking full speed. And if I'm trying to walk along a 55-mile-per-hour road, even if there's sidewalks, I take a penalty on it. And so this is sort of a perception of what it looks like. And so here's an example. I'm going between here and here. The fastest route is to walk along this 6-lane arterial, but weighted, you would walk this nice sort of bike path this way. And it's going to take longer, so we can record what that time is, but we assume behaviorally that people are going to take the nicer path. One of the reasons we do this is it gives us some ability to test the effect of interventions. That if we made the more direct route a nicer walking route, that you then get some benefit and more people likely to switch. When we look at the feasibility, what we did is we said, first, let's map the distance. We know most people aren't, for utilitarian purposes, making walking trips that are 10 miles long. We just plotted the trip distribution, and the blue here is the length of, or the frequency of trips, of walking trips by length. And the orange is the frequency of car trips by length. And so you see there is substantial overlap here, right? And we said, let's find the 95th percentile of the length, which happens to be 1.6 miles in this case. And say if your trip is longer than 1.6 miles, it's not feasible. We just cut it off there. And what that means is all of these car trips in here could feasibly walk. If you convince someone or if a person switch their behavior, they have that choice. Beyond this, it's not feasible to walk. And then in addition, based on the constraints of what I'm doing that day, do I have sufficient time to complete my trip without interfering with work or daycare pickups and a couple of things. So what we do is we then find, actually of the walking trips. 22% of car trips have a walking path less than 1.6 miles. That 22% of trips represents 3% of vehicle miles traveled because they're short, right? Sufficient time is available. 63% have sufficient time, and that's a high number because at the start and the end of my day, I can just leave home earlier or get home later, representing 57% of VMT. So that one's not much of a constraint in the same way, but you overlap these where both are the true, and 18% of car trips, representing 2.2% of VMT, could feasibly switch to walk. That doesn't mean that they will, it means that it's possible that I could. Then we come back and we look at the relative travel times. Okay, so what I can plot up here is the travel time difference between driving and walking. And so over on this side, it takes me 60 minutes longer to walk than to drive. On this side, there's some that are negative, where it's actually faster to walk than to drive. And the reason for that is we included some amount of terminal time in the car trips to get out of my car, walk from my car to my destination, this kind of thing. So you can go on either end of that. And what we plotted up is we plotted up the light blue are the trips that could feasibly switch. The dark blue are the trips that are longer generally than 1.6 miles, for which it's infeasible to switch. And the red are the trips that we actually observe on that. And so depending upon where you set this threshold for a travel time difference, if we pick 15 minutes here, you see, I mean, what, maybe a third or something of the trips that feasibly could walk actually do walk. So the area of the red bar is relative to the area of the light bars. But it gives us some sense of kind of what kind of travel time difference might be reasonable. At that, you've got these values here at 15 minutes, 13% of car trips and 1.2% of vehicle miles traveled could competitively switch to walking. Okay, so that gives us a way to sort of bound this problem or bound this question. When we get into biking, we look at OpenStreetMaps, we create the network, and we look at the level of traffic stress. So this is a pre-existing definition here. Traffic stress 1, you got a nice road. I've got here sort of some trees on it, some bike lanes. Here I've got maybe a little bit more traffic, interested but concerned. And then 3 and 4 are pretty busy streets. What we assumed here is you take a 10% time penalty for levels of traffic stress 2, and 3 and 4 and again, there's plenty of bicyclists who are going to bike on this stuff. They're probably not representative of a casual person who's not a bicyclist and is the person you want to attract to switch. You want to be relatively stringent on. And again, you can see here's one path that perhaps is the shortest distance path, but we're predicting a path here along the river instead as a nicer thing. We did a bunch of sort of validation, looking point to point, make sure we got reasonable paths on this. When we look at the feasibility, we've got several constraints here. This is my biking distance, and the blue is the distribution of biking distances. The yellow is the distribution of car distances. And what you see, bicycle trips are much longer than walking trips, right? The 95th percentile length of a bicycle trip is about 10 miles. So, okay, well, let's set the threshold there. If I'm less than 10 miles, it's feasible for me to bike. If it's more than 10 miles, it isn't. We're talking about Minnesota here. Anyone been to Minnesota in the wintertime?
A lot of bikes.
Bicycling is great. Bicycling in the snow kind of sucks, to be honest. So we sort of looked at things and we found, and we mentioned, we've got day by day data here, sort of when the trip was recorded. And so we looked at the weather service data, figured out when there was snow on the ground. And basically when there's snow on the ground, people stop biking for the most part, is what we observed. So we sort of added that restriction. We added sort of the percentage of the distance on high level of traffic stress facilities. Sort of looked at that and you found people might spend about 15% of their biking distance on high level of traffic facilities. So on the busy arterial sort of thing. And then you've got to have sufficient time. Okay, so we get in here. Bicycle distance is less than 10 miles, 67% of trips, of car trips, and 27% of VMT. Snow on the ground about 25% of the time in Minnesota. These distances no more than 15% on LTS airport facilities, 87% of trips, 93% of VMT there. Sufficient time is available and then feasible across the intersection of all of these. So to be feasible, it's got to be all of them. You end up with about a third of trips could feasibly bike and 13% of VMT could feasibly switch. Now we look at the competitiveness of that. Same sort of graphs here, and what we find if we sort of draw our threshold or draw our line at 15 minutes, you've got about 16% of trips and 3.5% of VMT that could competitively switch to bike. Okay, again, they're shorter than average trips, so that kind of makes sense to us. Transit then, we build using a transit pathfinder, and it's a variation or sort of an evolution of what Conveil does. But basically it's similar to what your smartphone is going to do if I search for what you have on Google Maps, if I search for a transit path on Google Maps. And so for trips to work in school, we calculate based on the arrival time. I want to get there on time, how early do I need to depart. For the other trips, I calculate based on departure time. And then we add some feasibility constraints. So chief among these is the access and egress distance. And we found that about 95% of transit trips, existing transit trips, have an access distance less than 0.9 miles and an egress distance less than 0.9 miles. So we're saying anything that's not within 0.9 miles of a transit stop is infeasible. Then we say the maximum waiting time for 95% of trips is less than 36 minutes for the first transit vehicle, and we constrain that. And then we observe that fewer than 5% involve more than 2 transfers. So we limit it to 2 transfers. And here's where you end up with sort of a map, right? Downtown Minneapolis is here, and then these are kind of the rural areas. You see some nice small towns in these community areas as well. But you can see that the trips most likely to be able to switch are sort of concentrated in the core. When you apply these constraints to transit, actually you get a bigger percentage that's feasible, in part because transit will go farther in a lot of these cases. So about 20% of trips and 12% of VMT can feasibly switch. Where you run into trouble with the transit is on the travel times. So there are many trips here in kind of the dark blue that feasibly could switch, but are not time competitive to switch because transit is slower in general. So you end up with, if we use the 15-minute threshold, 6% of trips, 1.2% of VMT. So when I summarize this, you've got sort of the feasible and the competitive, and this is the percentage of car trips, and this is the percentage of VMT that could be eliminated if every single person who could do one of these things and get there within 15 minutes of their driving time switched. And you get up, about 1% for walking, 3% for biking, 1% for transit. You add them up, there's some interaction of these, right? So there might be more than one of those as possible, so we're gonna take the best of them. And across any of them, 25% of car trips and 4.5% of EMT could competitively switch to one of these other modes. And then you can plot it up here based on the differences and kind of see where the different modes fit. Okay, so we're pretty far here from 20%.
Yes.
We got some work to do if we want to get to 20%. Number of trips here actually is a big deal though. I mean, so it depends a little bit if you care about cold starts or if you care about VMT, maybe that makes some difference. But this is kind of how far we get. Now, the other thing we did here is we wanted to do a little bit of sensitivity testing. And we wanted to sort of have some discussion on the planning side of what might it take to get here. We did just some really big picture scenarios of what would happen if you had some pretty big interventions. How could you expect these numbers to change? So we tested these 6 scenarios. Walk infrastructure, everywhere it's safe and comfortable to walk. So we got rid of these penalties for avoiding arterials and said everything is like walking down a tree-lined street with nice sidewalks. Bike infrastructure, it's safe and comfortable, bike everywhere it's legal to do so. You still can't go on the freeways, but everything is level to traffic stress one. E-bikes, we ran a scenario where you've got that, and also everyone gets e-bike, which goes a little bit faster, goes up the hills better, so we have a little bit of better pathfinding than. Transit frequency, double transit frequency, region-wide everywhere. And then a highway speed one. We went and looked at the NACTO Urban Streets Design Guide. They've got a sort of speed limit guide of arterials should be no more than 35 miles per hour, locals should be 20 miles per hour, this sort of stuff. And we said none of the car trips can go faster than this. And we're going to recalculate the car pass with those speeds. And then all of the above. So when we put these together, existing conditions, about 4.5% of the EMT. Our walk scenario where it's safe and comfortable to walk everywhere, that moves the needle a little bit, gets you to 4.6%. The bike scenario makes a big difference, right? If it's happy and comfortable to bike, you can get up to almost 12%. And if you give people e-bikes, you get up to almost 18%. Transit, you can go from 4.5 to 4.8% by doubling transit. The road scenario moves things a little bit. And if you did all of these interventions together, you can get up to about 16% that can competitively switch. Okay?
But your goal is 20.
The goal is 20. So you're gonna have a hard time, like this is a big lift, right? And I think, which is not to say that these aren't great interventions and wouldn't be a wonderful transportation system, is to say that be cognizant that this is a very challenging target to hit if our intent is to do so through mode shift. So big picture conclusion, I just told you what those were. And a couple of discussion points here. So as we sort of think about this, a couple things. One is biking has the biggest potential of these modes for mode shift. And so you can make it better by investing in proper facilities. The thing with biking though, which is interesting, is when you look at these little charts, you have all of this blue, which in the existing conditions are trips that feasibly could switch and competitively could switch to biking. The red is the number of people that actually bike. So the number of people that actually bike is way lower than the number that could bike. But just because you can doesn't mean you will. Well, what's it take to change that? Is that a cultural thing? Is it a like make it stop snowing thing? Is it a, I don't know. But there's big untapped potential in there. Second, as we start to look at this stuff, shorter trips have much more mode shift potential. So compact land use leads to more short trips with the double benefit. If you shift modes, that's great. If the trips are shorter, even if I'm still in a car trip that's half the length, well, that's great too. So it provides that kind of double benefit. In order to take advantage of this benefit, you're probably not going to move the existing houses. So, but it's a per capita benefit. So you need a sufficient amount of new growth in order for that to happen. That's probably a distinction between the Twin Cities and a lot of the California cities. Latest projections I've seen in California, population growth is like flat, maybe 1%. It's pretty, and I think that's a cost thing in part. So in order to hit that, you've got to be growing sufficiently so you can do that infill or that compact development. If you're not growing, you're stuck. And then finally, even with these broad changes, many trips remain that can't competitively switch, right? If I'm in a rural area, if I'm in a place where it doesn't work, I'm stuck driving. And that's the reality for many people. You ought to think about electrification policies specifically targeted to those trips that can change. If our goal is actually greenhouse gas, and if the life cycle emissions of an electric vehicle, even if you account for digging up rare earth minerals from somewhere in the Congo, are half of a gasoline powered, let's take those benefits. And pulling it back into California here, the other MPOs are going through this. MTC is now, I think they just approved the final blueprint strategy for their updated long-range plan, which includes a plan to meet those 19% reduction from 2025 levels. And just to give sort of a sense of this, as you talk to the planners doing this, they're saying they're throwing, this is ambitious when you actually look at the things they're doing. The land use is a big deal, and that's a big fight with some of the local governments. There's road pricing in there. Road pricing makes a big difference. They don't actually have the authority for road pricing. That's a state level decision. And CARB is the agency sort of overseeing implementing this. CARB has provided direction that any electrification policies, they will take credit for at the state level, but the MPOs can't take credit for electrification, and they've got to do sort of the greenhouse gas reduction dominantly through VMT reduction, and with the exception of if I'm maybe installing more chargers or something where you could encourage electrification faster within your region. But even so, I think it's sort of worth having some context of, it'd be great if we could build bike lanes everywhere and solve the climate problem. The reality is, me flying out here from Kentucky, I've got to do a lot of biking to offset one flight. So, and that's the other reason that shows up, and is you've got some portion of long trips, intercity trips. Trips longer than 50 miles in this country are about 1% of trips, about 20% of VMT. And that's just personal travel. You add in truck travel, commercial travel, that's probably another 20% or so of VMT. So the household-based travel is sort of actually a decreasing percentage of travel as time goes on. So let's think about kind of where are the buckets we can pull over to get towards these goals. Okay, and that's what I got.
Awesome.
Okay, great.
Questions for Greg?
Just earlier with the snow on the ground, you said that it's gonna reduce the utility for bikes in that case, where it was driving, would that be impacted as well, that people are driving less when they're still on the grounds? Is that included?
No, we don't. So, I mean, this is Minnesota, they actually know how to drive with snow on the ground.
And they plow it.
And they plow it. In Kentucky, it's like they will forecast snow and schools are closed for a week. Actually, what they do is and then there's a snowstorm and the city has not coordinated with the school bus district to plow the school bus routes. And so the streets will be fine on like the main streets, but there's certain local roads that the school buses drive on that are unplowed and school buses can't get past. It's like, as far as transportation problems that are fixable, this one is highly fixable. But schools are closed for like 2 weeks because they don't plow the darn roads.
Good question.
Thanks for the presentation. We did, I don't know, Casey, so we did a project for our demand monitoring class for a metric called bicycle potential for the city of Seattle. And we considered trips until 3 miles. We were mostly concentrating on the inter and intra-zone, which are adjacent to each other. In travel surveys, usually the trips are chained to each other from a starting point to the ending point. So while you're accounting for the trips in the analysis, are those trips, is the origin always house, a place where they pick up the car, or are these 3 miles, if you look at these trips which are less than 5 miles or 4 miles, are those independent trips or part of the chain trips? Is that considered?
Yeah, okay, so that's a great question. So the question is, if I'm going from home to work to the grocery store to home, am I doing those each independently? And the answer is yes. I'm treating, for this analysis, I've treated them each independently. The home to work is independent, the work to the grocery store is an independent trip, and the grocery store to home is an independent trip. And I've assumed for this analysis that they can each switch to any mode independently. We did another bit of this work where we said those are chained together into what we call a tour. And we added an additional constraint and we said, if you're going to change one trip on the tour, you have to change all trips on the tour. And that sort of pushes the numbers down a little bit further. The reality is, if you were going to do that, if I wanted to sort of bike to the grocery store, if I drive to work and bike to the grocery store, probably what I'm going to do is drive to the work and then come home instead of stopping on the way, and then go out and bike to the grocery store. Or actually, probably it's the odd, probably I'd bike to work, drive to the grocery store is what I'm more likely to do. And so in that case, then you get into a different level of behavioral change where you probably want the model to sort of predict that sort of thing. Here, we were deliberately trying to be a little bit simplified in it.
Thank you for your presentation. I'm wondering that we know women do shorter trips than men. And it is likelier that men do more bicycle trips than women. So could you potentially be seeing the fact that your model is, like overestimating a little bit the potential, the actual people that are doing the trips because of not accounting by maybe these particular reasons that women are is likely to bike?
So, okay, so the question is, am I underestimating the number of people who might bike because I've not accounted for whether they're men or women? I do know female, non-binary, whatever. And we didn't look at that. They both bike in sufficient numbers that we didn't add it as a constraint, right? So just in a purely sort of mechanical way, I was looking for things. If I meet this criteria, is it not feasible for me to bike? And sex or gender was not one of those. Whether it makes you a little bit more likely or less likely, we didn't consider in this particular case. I think the question here is then, okay, are we representative across those dimensions in the way we did the surveying? I think it's probably pretty good, right? It's in that particular dimension, there's probably certain biases in the survey. I don't think that's one that's gonna keep me up at night, in terms of whether we're over surveying one group or another. I don't know if that answers your question or not.
Well, I think it's more because of several studies I've read that, though it seems they don't have like the physical inability, like they can still do it. The likelihood of doing it is different because of the types of trips they do and maybe the risk factor that they're perceiving. And in that sense, like, they might be doing shorter trips, which would be like cool because a lot of the
Yeah.
shorter trips are likely to switch. But they're doing shopping trips plus picking up kids plus doing all these other things that maybe they're just not feasible in like a regular bicycle,
Yeah.
or they're not, or they're perceived riskier because of, being like in a crash or something. So like maybe though they don't have the limitation, like maybe other questions could help see. But I don't know how the model could be adjusted to include those other.
Yeah. I mean, so we would reflect if women are more likely to escort their children to daycare or to do grocery shopping. That is reflected in the survey. There are, somewhere I've got a chart on kind of how this varies by type of person and this kind of thing, which I can pull up for you afterwards. But mostly what we would reflect, or is that kind of thing we would reflect. The perception stuff, I think, is a feeling of safety stuff. It's not something I can do in this simple analysis. I think you gotta get somehow at the attitude, I think, for that. That's a good question.
So I'm gonna take instructor's prerogative to ask the last one. I'm curious about bike to transit, because a lot of the work that Reed Passmore and I did was showing that if we could enable more bike to transit trips, then you could have both the gains you're showing here with biking, but also for slightly longer distance trips. And you're not making this assumption of the walk to transit.
Right.
And I know Convail's model their software allows bike to transit. So is that something you guys thought about?
We thought about it and we didn't do it, just from a pure sort of simplicity standpoint. But yeah, I think it would not be difficult to change it, because all you're doing is you're changing the assumption about what the maximum access distance is.
Right.
As well as what that speed of access is, in rebuilding the path. So it'd be a pretty easy test to run and to evaluate. And I would have to imagine it would make things a lot more feasible, especially for sort of longer trips to
Exactly.
different places. So yeah, I think it's set up that you could probably, this is all open source, it's all available.
Okay.
You can run, actually it will be open, so it's still a private repository, but it's reasonably well documented. You ought to be able to run it. And if you got someone who wants to do that, I'm happy to kind of get them set up in order to test it out.
Maybe someday the navigation apps will also tell us bike to transit directions. Cause,
Yeah, unless she's OpenStreetMaps,
Yeah.
it's done some of the
yeah.
tools that Convail people build.
Yeah.
Or not Open Trip Planner.
I know no more questions. There was someone online from Minneapolis that did ask a question.
Yeah, he just walked in the back. Is there anything important? We're good?
It was just that one for Minneapolis.
Okay.
So.
I think the person just said, trust me, people bike or drive in snow in Minneapolis. I think that's what the comment was. So.
Yeah.
All right,
Okay.
super. We're already 5 minutes over, so
Okay.
I just wanted to thank both Greg for that.